Welcome to Mental Health Mini or Psych Mini number 8, where we're going to cover therapeutic communication. What is communication? Communication is the process of conveying a message. In order for it to be considered communication, you have to have three components. You have to have a sender, a message that is being sent by the sender, and a receiver who's receiving the message that was sent by the sender. There's a lot of different aspects that come into play when looking at whether or not a communication is received and sent properly and effectively. And we can assess that by looking at the two different communication types. So the first type is verbal communication. This is only about 5% of the communication that occurs. And examples of it are the spoken language and written language. So what is actually said using your voice? Then we have nonverbal communication, which is the majority of communication, anywhere from 93 to 97% of the communication we use. It is the most reliable form because it often conveys what we're thinking or feeling without us necessarily having to say it. Examples of nonverbal communication would be things like how we dress and how we appear, our body movements, like any hand gestures. If someone is shaking their foot, that may be conveying that they're anxious or restless. Our posture is another form of nonverbal communication. Our use of touch, our facial expressions, the level of eye contact that we're using, and then the intonation, pitch, and speed of our voice. Factors that can affect communication and the effectiveness of it are things like our values and attitudes, how we believe certain things. Our culture and religion can affect communication. Our social status, our gender, our age, our developmental level. Environmental factors like how is the noise level outside? Are there more individuals around that may cause interference? Are there things that may be distracting of that communication either being sent or received? One key technique when we talk about therapeutic communication is that it has to maintain or it has to have active listening. This is a key component of therapeutic communication, and it's the process of listening to understand, not to respond. It's based on acceptance, respect, and trust. And that acceptance, respect, and trust is both developed and demonstrated by the nurse. Techniques to having active listening is to face the patient, have an open posture, have appropriate eye contact. So that doesn't mean maintaining full contact all the time. It doesn't mean avoiding eye contact. It means being aware of that patient's cultural views on eye contact and following that. In active listening, we are also aware of any nonverbal communications that we may be sending, as well as picking up on any that the patient may be sending. And it also uses therapeutic communication techniques, both to elicit healing, as well as to identify and address any defense mechanisms that may come up with the patient. So now, what are therapeutic communication techniques? These are different techniques that we use to help the patient elicit meaning in their communications. The first technique that we can use, and this is often a very uncomfortable technique for both the nurse and the patient, but is very effective, and that is silence. So in silence, it's a benefit for two things. One is it allows that patient to have time to kind of process what they're thinking so that they can convey exactly what they need to convey to us. In addition, silence makes people uncomfortable and it kind of forces them to fill the silence. So it may get a patient that may feel uncomfortable talking with the nurse to open up a little bit. We can offer acceptance, recognition, especially of good things that they may have done or progress that they have made. We can use open-ended questioning, leading questioning. So that would be things like, tell me more about that. We can use clarification, especially if something that the patient's communicating to us is not very clear to us. We can use observations. I saw that you were talking with your daughter earlier today. Was that a good conversation for you? We can restate things. So what I'm hearing you say is that you would rather be discharged after the holiday than before because holidays stress you out. We can reflect with the patient. We can help reorient them to reality. We can voice doubt if anything that they're saying is conflicting. And then we can also provide feedback to the patient. And feedback should be thorough, it should be respectful, and it should be aimed at helping the patient grow and should not be used in a belittling sense. Non-therapeutic communication techniques, on the other hand, are things like offering false reassurance. And this is one that I think that nurses frequently do because it seems comfortable. So if a patient's really distressed and they're having a hard day, it just seems like second nature to say, "Don't worry, things will get better." That would be false reassurance. We have no proof, we have no insight, we have no knowledge that things will get better or that everything will be okay. So we never want to offer false reassurance. We never want to reject the patient's ideas, behaviors, thoughts, anything like that. We never want to offer approval or agreement, even if we do approve or agree with something that they say or do. And the reason why we don't want to do this is because it limits their ability to think and process things for themselves and to build their decision making. Kind of along the same lines, we never want to give advice to a patient because, again, that limits their ability to make decisions for themselves. We never want to defend or become defensive with a patient. We never want to belittle them or minimize them. We never want to stereotype them and base our communication and relationship on those stereotypes. We never want to use denial or interpreting. If we interpret things for the patient, then we're not getting a good understanding of how they interpret it. And we don't want to use unrelated topics to change a conversation when we don't want to speak with the patient. So lastly, some tools for therapeutic communication that we can use. You don't have to use it in order for communication to be therapeutic, but they are tools that help us to be more therapeutic, is motivational interviewing and process recording. So motivational interviewing is a specific process that we can use to help guide a patient to behavior changes through specific communication processes. It typically identifies benefit and risks to implementing a behavioral change for that patient and works them through different steps. So those steps and key components on helping a patient to make a positive change in their life is to express empathy, to avoid arguments, to roll with resistance, to develop discrepancy, and to support self-efficacy. And motivational interviewing is based on the concept that change is fluid. Some days we have more motivation for change and other days we don't. And we can use that motivation to optimize our behavioral practices. The other tool that we can use is a process recording. And this is an analysis of interactions with a patient. We typically record what was said, and then we identify everything that was said and communicated, both verbally and non-verbally. So through this, we can identify any therapeutic communication techniques that we used as a nurse and whether or not those were effective in the communication. If they weren't effective, it gives us the opportunity to reevaluate and think about other things we could have said or different ways we could have approached that conversation so that we can be more therapeutic in the future. It also helps us to identify any defense mechanisms that that patient may have been using. And that is a wrapping up Mental Health Mini.